Hello, my name is Dr. Karuna Satori. Nice to meet you. So you are here today for a full body exam, cranial nerve exam, correct? We're just going to be seeing if your senses are working today. The only thing we will be skipping is the nose and taste test because I can feel if you are congested, and those parts of your body work by feeling your lymph nodes and down around your neck, okay? So the first thing I'm going to be doing today is taking down some information, but just in case, I've been noticing a lot of my clients have been coming in lately with anxiety. So I have this, what's known as a fidget cube. I keep it with me all the time. I experience anxiety myself. I try to stick without medication, but I am not opposed to recommending it for those who truly need it, because I went through a period of time recently where I thought I truly needed it, and I'm still going through that. So I like to connect with my clients on a very personal level, and I feel like this is one of the very good parts of the internet, as this is where it became popular. So I think there are 6 sides. Forgive me if I'm wrong. 8 sides, I don't know. I can't count. I dropped out of high school, but I'm still somehow a doctor. Just go ahead and fidget around with it. It's like a toggle, circular thing. Buttons. Little ball to press in and roll. Things like that, okay? So I'll just set this right over here for you. So you go ahead. If you are feeling anxious at any time during this exam, please let me know and we can stop. I do have to ask permission if I may touch you during this exam, just around your body, filled down around your legs and up on your abdomen. I'll be feeling your stomach. I'll be taking your heart rate, your blood pressure, and temperature. So, great. So let me just figure out today my planner. I believe it's the 14th or the 13th. 14th. Forgive me if I'm wrong, but I think so. I'm just getting over a cold myself. I was going through a very bad period of brain fog. Have you ever had that? And with my anxiety, it really put me in a crazy area. I still get the brain fog here and there, but it's slowly going away. I think it came with this cold, but like I said, we'll be testing you for everything today, so no worries. No need for blood work. So, may I have your full name? You're on the chart. Your chart's right here under the appointment, but I still have to get some information just so I know it's you and everything like that. Date of birth, please. Okay. Allergies? Okay. Yeah, I seem to notice that this year I've been catching a lot of allergies. Did you know that you can become allergic to anything at any time in your life, no matter how strong your immune system? But no need to worry. All that's needed is a simple allergy test, and if you feel you're allergic, you can come back for one of those soon. So, okay. Let's see. Insurance? Okay. So your exam will be completely covered. No need to worry. Great. Okay. Are you on any medications I should know about? Yeah, I've been taking Tylenol. I've also been taking a pill. If you've been having any anxiety, depression, anything like that, common cold even, it's called N-acetylcysteine, or forgive me if I'm not pronouncing it correctly. I recommend taking 600 milligrams a day. You can buy it over the counter. It helps the brain fog if you've ever had it due to a common cold. It helps the cold. They give it typically to those who overdose on acetaminophen, which is Tylenol, ibuprofen, things like that. They call it the miracle pill, and it's very much helped me. I only took it for a few days though. I am 25 years old, and like I said, with my anxiety, I'm over here thinking I'm dying all the time, but I'm really not. So, okay, I think we are ready to start the exam. If I can show my planner. You're looking very vibrant. Yeah, you're looking great. So I definitely have high hopes for this. So, okay, actually, I'm going to have to keep this open. Find the page. I need to write down your blood pressure and, okay. So the first thing I'm going to do is get your temperature, then we'll get your heart rate and then blood pressure with the cuff. So this right here is typically used in hospitals in the emergency room, but I have them in my office just in case. I think I just heard a gunshot. No need to worry. You're in a safe place here. Okay. 98.2, that's excellent. I'm just going to scan on the other side just to make sure, because sometimes these things misread, but if it's in the 98 range, typically you don't have a fever, so no need to worry, okay? Great. Okay, so write that down. No fever. Okay. Next, I'm going to be checking your heart. So, I'm going to be doing around the chest area, on the back, and whenever I take your blood pressure, I'm going to take it with the cuff without this, and then again on the other side with this, just to make sure, okay? I like to be very thorough with my examinations, so. And you're sure you don't mind that I touch you, correct? Good. Okay. Deep breath in. Out. Okay. Deep breath in. Out. A good way to know that you are taking perfect deep breaths, which you're doing excellent, by the way, is it's called smell the roses, blow out the candle. Pretend you're smelling roses and pretend you're blowing out a candle, for example, obviously. Smelling the roses over dramatically and blowing out a candle, which is probably a trick candle because I get a lot of patients who like to blow out very hard. I do the same thing. There's no right or wrong way though, so no worries. Okay. Deep breath in. Out. Okay, now to check your back. Just gonna put my hand on your shoulder here. Deep breath in. Out. Okay. Deep breath in. Out. Okay. One more time. Deep breath in. And out. You did great. Excellent. Okay. Heart rate is perfect. Not too fast, not too slow. You look in perfect health so far for your age, more or less. Any surgeries in the past, by the way? Really? Okay. Yeah. No need for concern. Absolutely. So now I'm going to be taking your blood pressure. Don't judge me. We use old cuffs here. Okay, so I'm just going to get to your right arm here. Go ahead and pull it out to me. Roll up your sleeve if possible. Just all the way up. If you can't, no worries. We can still get a good reading, okay? Okay. Okay. Are you ready? So I'm just going to hold this here. Go ahead and pump, okay? Okay, brilliant. So next, I'm just going to put this back on and place the end of the stethoscope right here on your forearm, okay? Right in the center, where they typically draw blood while I'm pumping. Okay, so let me just put this back on. Your left. Go ahead, roll up your sleeve. If not, no worries. Okay. All right, you ready? Great. You definitely seem like you are in brilliant health. Okay. So now, just write that down and we can start our exam. The examination from here on out is basically going to be touching. I'm going to be checking your sight, but not with a flashlight today. It's going to be more along the lines of following my fingers, and you'll see. Okay, so I'm not going to need this for now. Do you mind if I take a sip of water, please? If you're thirsty, we also have fresh bottled water in the fridge. Would you like me to get you one? Okay, well, it's there if you need it, no worries. All right, so what I'm going to do first is I'm just going to go down your body and have you do a few things for me. First, I'm going to be checking your neck, your arms, feeling up around your arms, and then I'm going to be taking my 2 fingers and rubbing gently right here on your forearms, then on the back of your arms, and going up. Then I'm going to have you hold your hands out like this, and I'm going to hold my fingers like this. I'm going to have you squeeze my finger as hard as you can. Please don't break my fingers. Nobody hasn't done it yet, or nobody's done it yet. And then we're going to go down. I'm going to feel the top above your belly button, Feel your abdomen, see if it's soft, if you are defecating well. Moving down to your legs, just feeling the top of your calves, no worries, nowhere uncomfortable. Going down, I'm going to have you take your left leg and rub it on top of your shin, or your, below the knee. I'm going to have you rub it and then do the same on the other side. I'm going to put my feet up against your toes, and you're going to press your foot against mine and push as hard as you can, okay? And then we'll do the eyesight and a few other tests, okay? I'm going to check the back of your head, make sure the brain and the skull is still, no tumors eating away at the bone, things like that, but you look great, no worries. So let's begin. So first, I'm going to check your lymph nodes, and I'm also going to be checking your ears. So let's start with your lymph nodes. Your lymph nodes are right here, under the jaw. Have you ever had your tonsils out? Okay. They're a little bit swollen, but it is in the middle of summer. It's like 90 degrees out. Absolutely no worries. Typically, people's lymph nodes swell whenever, allergies, as I mentioned earlier, things like that. They call it the summer flu. It's just a cough, congestion like I have, nothing to be concerned about, absolutely nothing. So they're a little swollen, but nothing, like I said, to be concerned. I'm going to be moving down to your neck now. It's feeling around, feels great. Okay, moving over to your shoulders. Can you shrug your shoulders for me? Okay, again. And now I'm going to push down on your shoulders, and I want you to push up as hard as you can, okay? You've got a grip on you, okay? So moving down the arms. Okay. This might feel a little bit of pressure on your arms. Okay. All right, go ahead and put your arms out like this for me. I'm going to take two of my fingers. Just go. Okay, did you feel that? Did you feel that? Did you feel it any different from each arm? Now I'm going to do both. Just tell me if you felt different. Any difference? Brilliant. Okay, so go ahead, and I'm going to hold my two fingers up like this again, and I want you to wrap your fingers around these two fingers and squeeze as hard as you can. No worries, you're not going to break my fingers. Okay, you've got an excellent grip on you. Okay, hands to your side like this. All right. We're going to move down to your abdomen now. Okay, I'm just feeling around the belly. Okay. May I ask what your diet's like? Do you eat a lot of meat? Do you... Okay. Let me just feel around a little bit more. Any umbilical hernias I should be concerned about? That's where the tip or the very top of your belly button or surrounding is a little bit weak, maybe from either having children, sometimes in people's cases, but things like that. The abdominal wall can become weak from pushing or just overall working out too hard, things like that. So, okay. The only reason I asked you that is because your stomach's actually very soft. It seems like you've been going to the bathroom well lately. Do you at least use the restroom, typically not number one, more than once a day? Okay, that's great. And that's fine if you don't. Everybody's different. It has to do really, you can feel from around the stomach. If the lower part of your stomach is a little bit hard, that's fine too. Could mean that you just ate and you're digesting. As long as the very top, around the belly button area and the top of the stomach is soft, that means that you're overall in good health regarding your bowels. So, just kneading your stomach now. And I'm going to push. I'm going to push from the right side of you. I'm going to be pushing this way and just around. So it's like up and around your stomach. And I'm just going to make sure your bowels are moving and nothing is stuck or you have no masses or anything like that. So it's just part of the exam. Absolutely no worries, okay? Okay, so here we go. Does that feel okay? You're not in any pain? Okay, I'm going to do it again. Great. All right. Excellent. So now let's move down to your legs. I'm just going to feel the top of your legs. Okay. Okay, so before I feel down around your ankles and calves and shins or whatever, I'm going to have you take your right foot, lift it up. So pretend these are your legs and these are your feet. You're going to take your right foot, lift it up, and rub your foot along your shin up to your knee, okay? So right foot, lift it up, rub it up along your shin, okay? Okay, go ahead and do that for me. Excellent. Okay, and go ahead and do it for the, oh wait, left side. Great. Excellent. Okay, so now I'm going to have you put your feet on my hands. No worries, it's okay. I just sanitize in between each patient and just push as hard as you can, okay? Okay. Good. Again? Great. So let's move back up. And I'm going to be checking your ears. Could you turn your face to the right for me? I'm just going to lift up on your ear at the very tip. Look in there. Okay. Healthy wax buildup. And go ahead and turn your face to the left now. Brilliant. All right, so we're doing great so far. We're almost finished. Next, I'm going to feel up around your neck. Make sure your neck muscles are relaxed. If not, I will suggest going to a chiropractor in the near future. Tight neck muscles can also cause brain fog. I think I mentioned that earlier. If not, that goes to show that I still have it. So, okay, I'm just going to be feeling around your scalp area. Okay. You're doing brilliant. Feel around your head muscles. I'm going to be feeling your temples now. Cheekbones, right in here. Okay, can you open your mouth for me? Stick out your tongue and go, ah. Okay, close your mouth for me. And now we're going to do the vision test, all right? So I'm going to go a little bit quick with this. So I just need you to pay attention, focus as much as you can, and do what I say when I tell you, basically. All right, 2 fingers here, okay? Follow my fingers. Okay, take your left hand and touch your nose, and then touch my fingers. Don't put your hand down during, just go ahead and touch your nose and my fingers. Go ahead. Okay, great. Follow my fingers. Take your right hand and touch my fingers and then your nose. Great. Okay. Brilliant. How many fingers am I holding up? 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 What's 40 times 40? What's 3 plus 5? What's 10 divided by 2? Okay. Great. All right. You did absolutely brilliant. Now, the last thing I'm going to do, because we're pretty much finished, is I am going to try a very simple ear test on you today. So I just want you to tell me, listen to my voice. I'm going to talk very slowly and you tell me which side you hear any noise on, okay? It's like whenever you were younger in school. So I just did a test there. I did it on the right side of you. So I'm going to be whispering inaudibly in a way, and I'm going to need you to just raise the hand at the side that I make the sound on, okay? So, you ready? Okay. Here we go. So, my name is Dr. Cranial Nerve, and I am a licensed doctor in medical optics. A few words that I'm doing absolutely nothing problem in my life, but I'm getting there. Can you tell me a little bit about yourself? But can you just tell me which way the sound is? Okay. Raise your hand and make the sound. Brilliant. You did great. So, let me just write down the results and I'll let you know here in a moment. Yes, you were my most relaxed and healthy patient yet. You did excellent. I'm very proud of you. Do you know your blood type by chance? Okay. That's rare, is it? Maybe I'm wrong. We'll see. Okay. So you did so good today, and I am very, very proud. So what I'm going to do is, the only thing that I did notice that I would be a little bit concerned about is your fidgeting, and that was a test in itself. Sorry, I didn't mean to grab that from you, but just using this in a test in yourself, and I'd like you to take this home with you today. Go ahead and keep it on you in the times that you're feeling a little bit anxious, fidgety. Everybody has it. It's like saying that everybody's a little bit bisexual. No, actually, that has absolutely nothing to do with anything, but I'd like you to take this home, and when you're feeling a little bit anxious, go ahead and play with it a little bit, just forget it's there. Keep it as like your little buddy companion, and yeah, so I very extremely much enjoyed my time with you today, and like I said, if your neck muscles, are feeling a bit sore, make sure you're scheduling regular visits with a chiropractor, maybe get a vision test here and there. Just keep up to date with your doctors. That's one thing I learned at 25 years of life, is to always have a primary care physician, and it's time to start worrying about your health after you're about 21. So, all right, so I hope you had an excellent time here today, very relaxing. If you could, just leave me a review down below, and I will, down below, where does that mean? Okay, have a great day, and I will talk to you soon. Bye.